First guest on the show today from Henry Ford Health, Chief Medical Officer of Henry Ford Allegiance Medical Group, Dr. Tim Peterson. Good morning.
Good morning.
Morning.
Great to see you both.
Yeah, great to have you here. Before we jump in, we should probably explain a little bit about what Henry Ford Medical Group is and who's a part of that.
Sure, that's a great question. So I want to start actually by defining what a medical staff is and also what a medical group is, because those two terms sound really similar, but they're actually really different things. Every hospital in America has a medical staff. So any doctor, nurse practitioner, PA who practices medicine or surgery in that hospital has to be a member of that medical staff. They have to follow the hospital rules, they have to have their quality supervised. There's a lot of things that go around practicing medicine or surgery in a hospital. A medical group, which is what the Henry Ford Allegiance Medical Group is and what I'm the leader of, is an employed arrangement for physicians, nurse practitioners, PAs, what we call advanced practice practitioners or APPs. So that employment arrangement creates a group where we all come together, share resources, supervise each other, share benefits, lots of things that you can do as a collaboration in a group. The Henry Ford Jackson Hospital has a medical staff that includes many community providers who may be watching, may be taking care of people who are watching, and they practice in that building, medicine or surgery in the hospital. The medical group is the employed doctors, employed nurse practitioners, and PAs that also practice in that hospital, but also practice in the community, the primary care doctors, the surgery office, and those sorts of things.
So 6 months as in this role for you. How's it gone so far?
It's been fantastic. We have a really great team, some of the most dedicated, smart, caring people that I've had an opportunity to work with in my career. It's been really a pleasure to get to know them, to get to know the community as well.
Just last week, Henry Ford Health, along with all the major hospital systems in the state, announced a relaxation of the mask mandates. And for people working in the hospital, that's got to be great news.
You know, it's a bit of a double-edged sword in some respects. I mean, on the one hand, absolutely yes. It's great to be able to see smiling faces and interact with each other and with our patients in the way that we're all traditionally accustomed to. It's fantastic that the pandemic has gotten to a point where we all feel like it's safe to be able to do that. On the other hand, people still get COVID, and it can still sometimes be a serious illness. And so there is that kind of give and take, and we do have to make sure that we're wearing masks when people are sick. But we do have the freedom now when people are well and in common spaces to be unmasked. And it is really nice to be able to see each other full face again.
I think everyone over the course of the pandemic, well, maybe they thought they did some research, but everyone kind of became a little bit interested in healthcare, I think, over the course of the pandemic. What excites you about the future of healthcare here in our county?
Sure. So what really attracted me to this role was Henry Ford's commitment to the community and to the people that live in that community. There's a lot of opportunity here both for the Jackson Hospital, but also for the medical group, which I told you earlier is all the doctors and nurses that are practicing in our outpatient clinic buildings. There's a lot of opportunity to serve this community in a lot of ways that maybe we haven't traditionally been. And so part of my job is really envisioning that growth, envisioning that future, listening to the community about what the community needs from us, and helping build a diverse medical practice that's able to meet the needs of that community. So anybody that takes on this kind of job really likes the idea of building something big and grand and seeing the benefit that it's able to serve for the people around it. And that's really exciting because there's a lot of opportunity ahead of us.
So if we need a certain specialty in the community, if we don't have enough providers in that specialty, are you part of looking for beefing that specialty
Absolutely,
up?
yes. Yeah, I don't think we'll be doing liver transplants at Jackson Hospital anytime soon.
Yeah.
I don't think we'll be doing heart transplants anytime soon, but I think there's lots of things that we could potentially do more of or differently than we might already have been. And so it's just a huge opportunity for us to look around the community, see what the community's needs are, and figure out a way for us to be able to build that here safely and responsibly.
Yeah, I think like dermatology is an example where I think the health system and the medical group looking for dermatology practitioners for the area.
So that's a great example, one that I heard very early on when I started here in December. And I've actually reached out to some colleagues of mine that have a lot of experience managing dermatology practices to try and understand what it would take to successfully build a dermatology practice here in Jackson, in the city of Jackson, in the county of Jackson, to meet the community's needs. And it'll be a bit of a challenge, but it's, challenges are why you sign up for jobs like this. So
Dermatologists like to go to Naples, Florida.
That's where all the skin cancer is down in Florida.
So I don't have a medical ailment that I know of right now, but
usually Andy
I
likes
always
to.
have a little something going on. Let me ask you about food poisoning.
Sure.
Can you catch food poisoning from someone that has food poisoning?
Well, food poisoning, is a
right.
colloquial term that generally means a lot of
ache.
vomiting and or a lot of diarrhea. So it can be caused by a lot of different things. And sometimes, yes, if it's caused by an infection in a person's intestinal tract, absolutely yes, it can be contagious from person to person. Most things that we think about as food poisoning are actually not an infection in the colon, but a bacteria or a toxin that was in a food product. And then once that toxin passes through your system, your symptoms are all better, and you can't really pass the toxin on to another person.
Yes, and Andy has that question today because we have an employee who is not here today because of food poisoning.
That employee made a great choice.
Yes.
Please wash your hands before you come back to work.
Please, yes. I think the whole family's down with the old FP.
Yeah, it runs through the house.
Yes. I guess it can.
It can. I think I know how it started.
I do
actually.
too.
Yeah. So all during the pandemic, we were, as a community, supporting the healthcare providers, our everyday heroes. As we're hopefully at the tail end of the pandemic, the support of healthcare providers is still important. Now, what's the best way that we can continue that support?
That's a great question. I really appreciate the perspective on that question. It was really gratifying as a practicing doctor, also as a leader of medical group, to see that community rally around the providers, all of us, whether it's the housekeeping staff keeping the place clean, whether it's the nursing staff, the folks answering the phone. I think everybody in the organization felt that community support for the work that we do to help that community be healthy and well. I think the single most important thing any of us can do for our provider team is just to say thank you, truthfully. I mean, we all went into this profession because we wanted to make a difference in the lives of others. And just hearing a simple thank you is all any of us really need to feel that reward in our day. But we're also ready to hear anything else that the community needs from us. So actively engaging in your care, talking to your doctor, your nurse practitioner, your care team about what the barriers are for your care, what you need in order to be healthy and well. That's the stuff that we want to be able to do for you. So giving us that information helps us do our jobs better, which is incredibly rewarding as well. And that's really all we need from our patients in our community.
Do you remember what it was that inspired you to get into healthcare?
I really just wanted to spend my time in my profession doing work that I could believe in and felt like made a difference in the world. And I chose, so I practice in the emergency department here at Jackson Hospital. I chose to be an emergency medicine doctor because I just wanted to be able to take care of anybody that walked through the door. I love catching babies. I love treating heart attacks. It's really awesome to be able to cut somebody's chest open and massage their heart and keep them alive. Like the things that I get to do as an ER doctor is incredibly diverse and incredibly rewarding.
Wow.
And the stuff I get to do as an administrator builds the environment for doctors and patients to be well. So I get to work on both sides of that fence. I have the best job on the planet, and from my perspective.
Catching babies. You're not throwing babies around, are you?
No, of course not. We catch them gently.
Shop talk.
Yeah.
That's doctor talk for
Shop talk, yeah.
delivering a baby.
Delivering
That
babies,
is very
which
good.
mercifully does not happen much in the emergency department. But when it does, it's a real privilege.
Dr. Tim Peterson joining us on the morning show. Thanks so much. We hope you'll come back and see us again.
Thank you for the opportunity.
More of the morning show right after this quick break.